Beautiful. Okay, so where is your beautiful face on my screen? Okay, Diana. Oh my God, I'm so happy that we finally did it. Do you guys know that we've been planning this live for probably at least a month and a half, right? Was it
More,
more? It was more.
more. It's definitely been longer.
So, first of all, welcome everyone. My name is Yelena. I am the disruptor for today. And I started this journey with this little mini podcast, I guess you could say, but it's really conversations that we must hear a little while ago. And I started it with two women who I interviewed because I thought their story was beautiful. But then I thought about it over the years and I said, you know what? Um, I meet incredible women in my line of work, right? And I network a lot. And I met a woman with my last live, and I was completely blown away at the information. If you guys have not watched Cancel Your Mammogram, please go to my YouTube channel and replay it. It's an incredible new thing for me, at least, and for thousands of women that have watched the replay, that have called me, and oh my God, it was incredible. And so these are the type of women and men I want to bring to you. I want you to hear from. And Diana, Dr. Diana Kopach, this today's guest, is no different. So I'm super excited for having you today. Thank you so much. And
For
in a
having me.
second, and in a second, I will, give you the microphone for you to introduce yourself. But before we do that, today we're talking about a really, really huge topic, and that is dentistry. Now, you guys know I'm a cosmetologist. I'm a New York State licensed cosmetologist. So for some people, what does she know, right? We always kind of discount what person can do on a side outside of their trade. And that is a very strange way of looking at people because a lot of us are very intelligent enough to do our own research. And I believe I'm one of those people that actually does a lot of research. And I love doing research because I do have a big family, thank God. And I'm looking into things a little bit differently than when I was looking at it when I was single, before I was married. And so when I hear about, whenever I took my children to the dentist and the dentist would say, now we're going to put a little fluoride, there's this foam thing at the end, it'll protect the teeth. So in the beginning, like with my older two kids, I didn't really know a difference. So I'm like, cool, because she said it'll protect them from cavity and it'll seal the teeth. Great. But then as I was doing more research, I realized that there's a lot of chemicals that go into the body that are completely unnecessary. In fact, they do the complete opposite of healing or treating. They're disrupting the whole system. And then we're thinking, well, what's wrong with my kid or what's wrong with me? I don't understand. And so another side to this, and I'm talking strictly dentistry right now, another side to it is when we are going to the dentist, we trust the dentist, right? And we're thinking, okay, so let's just continue doing this. But then we really don't understand the two worlds when the dentist tells you you must have it because otherwise you lose your teeth, it'll go, it'll be terrible. On the other hand, you're thinking, but I don't even feel anything, like I'm okay, are there other alternatives? So I'm personally kind of stuck in between this two worlds for many, many years. And so after I started getting into it, I realized that there are alternatives. And when I spoke with Dr. Diana, I literally straight up asked her, and I know her for a little while now. We actually live in the same neighborhood now. We're neighbors. And so we started talking, and she started saying, I'm a holistic dentist. And I said, what is a holistic dentist? Because I've been going to regular dentists for a long time. I drove them crazy not to put this on them and not to put that on them. But now that we have holistic dentistry, I said, is that a real doctor? She goes, yeah, I'm actually a real doctor, but I also, it's a burning question. Is she a real doctor? She is a real doctor. But also at the same time, she did go and further her education and became more knowledgeable, meaning holistic means, and correct me if I'm wrong, is a full body aspect of it, meaning it's a whole as a whole, right? So I'm going to give the mic to Dr. Diana to give us a little, bio of who you are and what you do. And then I have a ton of questions for you. So let's get right into it.
Okay, wow. Thank you, Yelena, for such an introduction. I love hearing all of that. I am going to actually touch on fluoride at some point as well. That is huge. Hi, everyone. My name is Diana Kopach. I am a DDS, Doctor of Dental Surgery. I am a dentist. I graduated from NYU in 2013. did my residency at Jamaica Hospital, and was blessed with starting to work for a holistic dentist straight out of residency. And just like you, Yelena, I was like, what, holistic dentist? Like, that's a thing? That can be a thing. But you attract things to yourself because of who you are. And all my life, I've always been into meditation and yoga and just like breathing right and against antibiotics and all these things. So to hear that there was a field within dentistry, not officially, but a field within it that embraces all of that, I was like, okay, so this is what I need to be doing. I started working for Dr. Alex Schwartzman out in Smithtown. Huge commute, but it was worth it. And eventually, I learned more and more about the field. And just a few years ago, I actually got board certified as a naturopathic doctor as well. So I officially, know more and more about how our body processes things and made connections to dentistry. So yes, I actually look at things not as, a tooth by tooth type of thing, but how is your oral cavity connected to the rest of the body and vice versa.
Amazing. So I'm actually looking down because I am looking at the chat and just responding because I want to make sure that I'm being hospitable, the Bukharian in me, like, oh, hello, welcome. Please have a seat, have a shashlik. Yeah. So that's the Bukharian in me. So excuse me. I'm not ignoring you, but I want to make sure. Hi, everyone. Hi, Lisa. Hi, Lilia. Hi, Michael. Welcome, everybody. So I'm so happy that you said that if right straight off the bat, because I know I'm going to get a million questions. Is she a real doctor? What does she know? Tell me what are her... She's a DDS. Doctor of what?
DDS and
dental surgery. Okay.
And I'm an ND, the naturopathic doctor.
Amazing. So let's get right into it because I want to get to the meat and potatoes of the conversation. We don't want to waste our time. Sure. Because it's Shabbos is coming, right?
Right, we gotta prep.
Nothing with you guys. No, but right now I really want to get into a very important burning question that a lot of people ask about. As soon as I mentioned I'm going to be interviewing somebody in holistic dentistry, and everybody's like, talk about a root canal, and I was like, let's do that, because I'm sure some of us have done it a few times, and we're probably thinking, and those of you that have not, good news, you're in a much better position because this is actually going to be more relevant. But if you have had it, don't worry, just stick with us. We'll explain everything. So root canal is a dead tooth and nothing bad is going in there. Is that a false or a true statement?
Oh, nothing bad is going in there? That's definitely false.
Okay, so that's what I was thinking myself, because I've done actually a lot of research. I went to the FDA website. Remember, I was like sitting there, like literally reading through things. I'm like, what does FDA say? Because we're in the United States and we have to go by certain rules, right? And the Academy of Dentistry and all of that. So I've done my research, and in the research, there's so much about mercury. There's so much about killing the root and how it affects the body, and how teeth are teeth. It's right here. It's just chilling in your mouth. You're eating with it. Great, right? It helps you with your digestion. That's where digestion begins. That's all we really learn in school about it, right? I'm talking about the rest of the world, not the dentists, right? You guys know more. So in my mind, I thought, okay, so if we pull a tooth out, we just pulled the tooth out, right? Or if we do a root canal, we just killed the roots and it's great and it doesn't hurt anymore because it's so annoying, right? But it's more than that. And I want you to introduce us to what is this thing called more than that? What do the teeth connect to? And how it is a domino effect for other potential hazards and disruptions in the body.
Okay, well, I mean, you opened up a humongous question there.
That's what I do.
There's so many connections there.
So let's start small. What happens in the minute of the root canal? Yeah.
Let's start smaller, right? So what, like a tooth, right? We have a tooth. What's in the tooth? The tooth is layers. The part that we're seeing, that crown part, that's enamel. Then you have right underneath that, the dentin. That's actually what's giving the tooth color and where like the nerve endings of the tooth get started. So the sensitivity starts from there. And then right below that, you have the pulp. That's where the nerve starts. And as you go lower, the root of the tooth, the part that we're not seeing, is within the bone. And some roots are gonna, some teeth are gonna have one root, some teeth are gonna have two roots, and then there are other teeth, the molars are gonna have three roots, the upper molars. So when you have
So
a root
speaking
canal,
English, the molars are the back teeth,
the
right?
back teeth,
Okay, I
that's
just want to make sure everybody's like, what's a molar? Google search.
right.
Okay, go ahead.
So if you're at a point where you're having a root canal, that means you've had a cavity or something to that extent. It's gotten so big, so bad that it's gotten to the nerve. It has injured the nerve. There's likely bacteria going on there. And now generally a specialist, or a lot of times general dentists, will do what's called a root canal. They go in there, they clean out the nerve, all of the vascular tissue in there. They pack it in with a plastic, some plastic material, and close it up. And they think, okay, it's all done, capiche.
So one second. One second, because I want to make sure that we break it down in the seventh graders mentality, right? So that everybody understand. What are those things that they are putting inside the canals, not that they've removed? What is it?
So it's actually just this plastic like condensation. That's all it
They
is.
stuff it with it, right?
Plug it up. That's all it is. It's to plug it up. It's not really medicinal. It's not doing anything, moving forward to help the tooth in any way. It's just they feel, they cleared out the canal and now they can plug it in and we can close up the rest of the tooth. Back in the day, I'm hoping not so much anymore, they would often plug it in afterwards with amalgam or the mercury fillings as well. So now you're forever stuck with this stuff in your mouth.
Incredible. So keep going. Keep going. What's going into the rest of the body?
So then what ends up actually happening, right? Because the main canal is plugged in, but there are all of these other canals that are actually in the tooth. They're generally not cleaned out. It's very hard to get any sort of proper cleaning out in that area. So bacteria can continue to form in there. Yes, they might not be coming from the crown portion, right? From where we're eating, from what we're seeing, but there's still that connection on the interior of the body. So because the body is connected, there's still, bloodstream going on here, nerve endings everywhere else. The bacteria can still fester there and grow. And oftentimes that's where you're getting like failed root canals because it's not successful, right? If the bacteria is there, like any other kind of surgery, if it didn't take care of the actual problem, it's considered a failed procedure. So you're still festering, the bacteria there, the infection is there. And because it is connected to the rest of the body, all of that bacteria can actually travel everywhere else. And now you have these inflammatory processes going on a regular basis. So
So can
yes.
you tell me, so I love this conversation. So we literally, somebody just commented can of worms, like we opened the can of worms, but it actually, without opening some can of worms or like the Pandora box, right? I actually read about it recently, what it is. But when we open this up, that's when people are starting to fear and stress and think, oh my, they're like overthinking all the decisions because now we've shaken up what we thought was our comfort zone and our, the healthy place. We're going to, every 6 months, we're going to do cleaning and get our x-rays done. And we're thinking, great, great, great. But all of it was actually happening on the surface.
Yeah.
It's all just happening on the surface. It's sort of like we keep putting all this makeup on our face, but the acne doesn't go away. We never treat the acne. We never treat the underlying problems, the eczema, the breakouts, the internal disruptors, the endocrine disruptors, right? The lymphatic system failure, which is the biggest system, I believe, and I come from the beauty industry. Lymphatic system is something that no one even looks at. I never heard a doctor tell me, Elena, you should do a lymphatic drainage. Never. Or like, let's check out your whole endocrine system, right? Nothing. We don't look at anything holistically. And I'm gonna try to use a different word because sometimes it triggers certain people because they can't associate holistic with whole. They associate, a lot of people associate holistic with something we're brewing in the backyard. You know what I mean? Like
I know.
Like, and the same thing with my line with my healthy makeup in the beginning when I started, like, what do you do? Like, is it in the backyard? Like, no, 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 it's all science based.
No, when I tell people I'm a holistic dentist, they're like, what? You like pray on the tooth or something? I'm
I
like,
know.
great, you know?
So the thing is, oh my gosh, thank you so much for joining, you guys. There's a lot of people on. Okay, perfect. So what I want to do, what I want to discuss, and what I want to do, actually, I want to scare the crap out of people. Excuse my French. Why? I'll tell you why.
Okay.
Because a lot of people sugarcoat everything. You don't understand what I'm doing here today. What I'm doing with these lives is I'm trying to wake that person, right? This isn't for everybody. Some of you already know this, but it's for that person that's kind of still either in lives under the rock completely and thinks like the medical community, which by the way, I'm not bashing the medical community. We need the medical community. Okay. I just want to make this clear. What I want you to understand is it's that person who only goes one way, right? And when we are talking about dentistry, right? My grandfather was actually a dentist.
Wow.
And he always made us floss, always made us brush our teeth. He would always check and he's like, what? Oh, it's good, it's good. Like all the time. He died at 86 years old and he had all his teeth,
Isn't
which
that
is
amazing?
which is like, what? Excuse me. He never had a cavity. So
Wow.
I come from this background where he also was telling us that every tooth is associated with your organs. You can't just pull out a tooth or just like kill a root and think nothing's going to happen to your body. It's a domino effect, right? So these lives are for those people who are kind of either still live under a rock and don't think that teeth are associated with the rest of the body, or they're kind of like on the fence. I kind of want to go to a holistic dentist. I'm kind of Googling some stuff, but I'm not sure because what if something goes wrong? Is it medically like approved? Is it? So this is why we're here. So if you have any questions, please feel free to ask, whether we answer on the live today or you're replaying this and rewatching it. Just ask questions. And so it's super important to understand that. Okay, so let's get that out of the way. So Diana, let's talk about the domino effect, right? So a lot of people are getting their root canals done. It goes into the body. All the bacteria can collect underneath the tooth, right? And generally, I've done research on this, people don't feel the pain there because there are no nerves, they've been taken out. So it doesn't bother us, we don't feel it. And sometimes I've read stories, the pools gets pulled out by holistic dentists, and they see how much bacteria and how much like,
There. Yeah.
right? So I want you to tell
And
people
you know,
the
interestingly
truth.
enough, sorry. So interestingly enough, there has already been research shown, and it was years ago, right? Because the people that I learned from have been in the field for ages, and they've been trying to wake people up for all this time. Like there has been research, there have been studies that shown for women that have had breast cancer and had root canals, the exact same bacterial species that was in the breast tissue was in their root canals.
Wow.
And so when people are saying there's no connection, like there is, it's already there. But we're not, unfortunately, the vast medical community is not privy to this information unless you are going out on your own to look for it. And the information is there, but it's not something that's taught at the medical schools or at the dental schools. Because at the end of the day, and again, this is a can of worms, most of the research is backed by big pharma. And it's not, in their
Best interest, unfortunately.
exactly. So you have to look at who's writing the papers, who's getting that information out to you, but it's there. So when people say it's not backed by science, it is backed by science. You have to find the right, information.
And that's a perfect way to kind of keep going on this, is that you
But
have to find the
even
right information. We live in the information age. There
kind of
is
like
no excuse not to know. There's no more excuse not to know. We've opened, especially after the pandemic. I feel like people have opened their eyes on many things in a holistic world. So tell me more about, because you spoke to me when we had our conversation before this. You told me about muscle testing. You told me about amalgams, right? You told me about the
let's
mercury.
go through a
Let's
couple of
go
things.
one through, like, let's touch upon those things. And also, please, it's such a big subject, and I'm trying to keep it like very small, but it's impossible. So let's just
It's
get
possible because you're going to everything.
right.
You
So
started
talk to me about
actually,
it.
you had started this whole thing with fluoride. So it sounds so basic, right? We've been taught about it for years, and most dentists are still talking about it. They will still push fluoride on people. I have patients coming to me on a regular basis, young families that they're stuck. They're like, we go to our dentist and they keep wanting to put fluoride in my kid's mouth. But the research is already there that it's a neurotoxin. It is harming the body, that ingesting fluoride in any way is an issue. There is a whole case, that had been going on in California. It's been up there. The research is there. Yet dentists are still pushing it. And yes, though the fluoride can help the tooth, if you can somehow keep it just on the tooth without it entering the rest of your body, yes, it can help your tooth. But is there any way to actually isolate it? No, because it's going to go into the saliva, which is part of your body. You're swallowing it. It goes into the salivary gland. Like everything is just connected. So you don't live in this bubble, where you could just put it on the tooth. And now there are so many other ways to help remineralize the teeth. Nanohydroxyapatite. It is huge, huge, harmless, and good for you. So why use a toxin when you can use something that is a great alternative, has all of the benefits without any of the side effects? Right? But again, people are not willing to actually do the research and speak out about it. So fluoride is one of the huge things that I stay away from. I do not use it in my practice. I refuse to have my kids use it. And because I don't, some people know I am blessed with 4 children. Whatever I speak about, my kids are using. Like, this is how we work. Another huge one is amalgam. I'm still seeing people all over the place with amalgam fillings. I was actually telling you, I had a woman calling me frantic about a month ago, and she got lucky because I picked up the phone. She had recently moved from Russia and had taken, so she was speaking Russian, and I was able to help her. She had taken her daughter to a dentist here, was told the kid had a cavity, agreed to having the cavity filled. The daughter opens her mouth afterwards and mom sees metal in her mouth. This is on a child, meaning this was done like just now. She calls me, she's like, I don't understand. This is America. In Russia, they're not doing this. How are they putting mercury still in the mouth? Like, it's like mind-boggling that this is still happening. And amalgam fillings can be up to 50% mercury, which is toxic. So why are we walking around with this stuff in our bodies every time you're chewing, right? You're grinding, you're chewing. The mercury vapors are being released. It's toxic for the entire body. And even taking it out has to be done in a very specific way. So dentists themselves have been exposed to huge, amounts of mercury over time, both during placement and during removal. If we're not protecting ourselves and our patients when it's being taken out, we're again, it's very, very dangerous.
So let's talk about heavy metals for just a second. We'll just pause and talk about heavy metals for a second. A lot of times whenever, and I see this because I'm part of like mom groups, because when I had my twins, I went into 2 different groups because I was like, I don't know what to do with twins, that like you're becoming a mom for the first time. So I actually started seeing this trend whenever somebody would write something about anything that we're drinking that contains like aluminum or whatever, people start saying, oh, please, not enough of this already, because breast milk also contains aluminum and it has heavy metals and whatever. So here's the thing about it that I want people to understand. Heavy metals are pretty much anywhere, right? We live we don't live in a forest, right? We don't have our own cows that we're milking in the morning. There is a certain amount of heavy metals that is going to go into our food. But when we're literally paying money for aluminum pans, right? Toxic cookware or amalgams in our teeth, we are in control of those things. So yes, if breast milk contains a certain amount of something, it's fine. It goes through the digestive system. Our digestive system is smart enough to get rid of the toxins and keep what's necessary. Okay? If anything goes through your digestive system, it has more percentage of getting it out of your body through the excretory system than if you're injecting it, right? Or when they're putting it literally in your mouth, right? Through the muscle or through your mouth. This is something that we can't get out. It's literally goes straight into your bloodstream, disrupts your circulatory system. It goes down through. So when we're talking about, like, the FDA allows, I believe, 25 milligrams or 50 milligrams a day of aluminum or something like that. But we are getting it from everywhere. Why? Because we buy it. We are uninformed. We are getting our fillings filled with these things.
And
So
you know what's crazy, Liam? I'm sorry, but so the mercury that we take out, right? Every dental office that's drilling mercury needs to have a very specific, like, amalgamated, like, things to, once it's out of the body, there's a way that we have to dispense it. Standards for this, right? Guidelines. So imagine, why is it okay for it to be inside your mouth, but the moment we take it out, we cannot just throw it in the garbage. No, it cannot just go through, like, regular, systems of where things are cleared out of the chair and whatnot. It has to go into a very specific container, has to be picked up by, like, a hazard,
a hazard. It's a hazard.
and taken out. Isn't that interesting? But you want this inside your mouth? Like, really? Like, just common sense right now.
It's insane. So thank you. So let's continue to, talking about the root canal and what it does to the body. Please talk a little bit about how the teeth are connected to the organs and why it's important to, when you go to the dentist, to look at the overall, I guess, individual body that's in front of you, because I'm not the same as you, you're not the same as me, we're all different. So why is it important when I go to the dentist? Dentals asks other questions. My heart, how's my system functioning? So can we just talk about that in connection to the root canal?
Okay, so now this is already definitely straying from traditional dentistry and traditional outlook on things, right? As I mentioned before, I've always been a very biological, like, holistic, in the sense that I'm very spiritual. I firmly believe that our body is interconnected with everything, right? Every single part of your body is connected to everything else. And generally, if you study, like, Chinese medicine, Eastern medicine, they're very, very big on that. Like, meridians and acupuncture points, like, why do they work? Because every single part of your body is connected to something else. Similarly, every single tooth in our mouth is connected to a body organ. So each tooth has its representation. And we'll often see that, people that have, for instance, a cavity or an issue with one tooth, if you look at the body organ that it's connected to, they will have a problem with that organ. They currently have, like, a problem with that organ. So similar, for instance, with root canals, if the woman had a root canal on the right side, generally it would be the right breast in which, like, the cancer would have been found.
Wow.
So, that's why I'm not into arbitrarily just pulling teeth out, because at the end of the day, you are disrupting the meridian, the vibrational energy for that organ as well, and it is affecting it. So I'm not someone that, just, like, it's okay with teeth being pulled out, which is why I'm also so focused on conservative and preventative dentistry. For me, it's all about, let's get in there early and see what we can do to avoid, if possible, drilling at all. If we can remineralize the tooth, and there are ways to do that. If we are in there early enough, there are ways to remineralize the teeth and not need to drill. Or if we need to drill, there are ways to avoid a root canal. Using biomimetic dentistry, using ozone therapy, using supplements there, it's a very integrative approach to how this is done, but it can be done. So, people often think, I was already told I need a root canal because I have a deep cavity. If that is the only reason, if you did not abscess, there's not like that big infection and whatnot going on. If the only reason is because you have a deep cavity, you can very likely, as long as the tooth is still alive, you can avoid that root canal, but you need to get in there. The tooth has to be properly treated. So
So what
yeah.
you're saying is that, okay, so let me go into, because some of these questions are actually relevant to this.
Okay, go for it.
First one was by Michael. It says, what's the least painful way of treating a root canal? I guess it's a loaded question. What is the least painful way of treating a root canal? I don't know. I'll let you answer that.
Yeah. So is the question, the tooth has already been root canal treated?
I think what he's saying, what I think, and maybe Michael, if you're still on, if you could just clarify, I think what he's saying is that if you have to do a root canal, is there a least painful way of doing it? Or maybe he means to treat like if you have to do root canal, is there a way to treat it that's least
Want to be
painful?
numb. You want to be numb. I would definitely suggest that you go to a practitioner that's going to numb you. So you're not feeling it. That's the best way for it to not be painful.
But
My
can you avoid a root canal? I think maybe that's what he meant. Can you
so
avoid
yes.
a root canal that when a doctor already told you you need a root canal?
So in this specific situation, so that's what I was clarifying. If you already have an abscess, which means you already have a pus pocket there, right? You're swollen in any way, whether it's swollen on the outside or on the inside. If the tooth is already abscessed, which is, it's dead, it's no longer functioning properly, the bacteria has gone too far. Unfortunately, there's no avoiding a root canal in that situation, assuming you want to save the tooth. The only way to keep that tooth inside your mouth is to do a root canal on it. It's either that or you pull the tooth out and you place an implant, ideally. However, if the reason you were told that you need a root canal is because you have a deep cavity, but you're still sensitive on that tooth is still alive, right? It's still what we call vital, then potentially we can still save that tooth without doing a root canal.
Wow. And I'm sure I'll tell you a story quickly about my situation. I never needed a root canal. She drilled first, then she did the x-ray. I was like, I don't know, early 20s, maybe late teens. I went for a checkup and she says, "Oh, let me see your tooth." And she drilled it a little bit. And then she's like, "Let me do an x-ray." She did an x-ray and she goes, "Oh, you need a root canal." This was back when a lot of this was back 20 years ago. I'm sure you remember this, when a lot of scam was going on with the root canals, when they drilled first and then they took an x-ray and then they did the root canal because they would make the money. I was one of those victims. And I found out about it when I went to another dentist and he requested x-rays from another place. And he's like, "You didn't need a root canal. It looks drilled." And I was like, "Oh my God." So I got a root canal for no reason. And I'm sure I'm not the only one.
I
And
see it all the time, and it scares me that it's still going on. Patients coming in told that they need a root canal. I look at their x-rays and I'm like, what are you talking about? I'm literally, I'm like, and I'm so torn because it's like you went to a doctor and they told you you need a pretty invasive procedure where you barely have a cavity on this tooth. Like, like it hurts me. It really hurts. Like,
you guys
how
hear
are
this?
we supposed to be trusted if this is what's being told to people? Or I'll see patients that have had a ton of fillings done, but they're these like tiny little fillings that I know for a fact they could have totally gone without drilling completely.
That's
Completely.
crazy.
It's it's upsetting. It's extremely upsetting.
So another question is by Regina, is how do you save the tooth with cavity and how is it reversed?
Okay, so this is where the integrative approach is so needed. This is where My former mentor, may he rest in peace, he would refer to the traditional dentists as tooth carpenters, because that's what they would do, right? You see the problem, you cut it up, you fill it in, and like that drill and fill dentistry. And that's kind of what I try to stay away from. So this is where we have to look at everything. The tooth, you don't get a cavity in isolation. It's not, contrary to popular belief, it's not just the sugar, right? That's not all it is. A lot of things need to be changed in order to remineralize a tooth. Your oral microbiome is a huge component of that. We need to change what's going on in the mouth. Everything is affected by bacteria. There's good bacteria and there's bad bacteria. There's bacteria that's causing cavities and gum disease, but then there's bacteria just like in our gut that we need in order to properly process things. So what do we need to do? We need to kill off the bad bacteria that's causing these problems, right? That's causing the cavities, that's causing the gum disease. And we need to get good bacteria in the mouth. We need to change the oral environment. So I in my practice use different things for that. Ozone is one of them. It's a huge component of my practice. It actually helps kill this bad bacteria. And then we want to get good bacteria in there. So I talk to my patients about using proper probiotics that are specific for the mouth that they need in order to repopulate their oral microbiome. And we use other remineralizing agents like nanohydroxyapatite. I talk to them about supplements. There are certain supplements that are very much connected to proper collagen formation that then helps with remineralizing teeth. So in certain situations, when a cavity hasn't actually made a hole in the tooth, when the cavity hasn't broken through, remember I was talking about the dentin layer? So you have that enamel layer, that top layer, and then the dentin layer. If the cavity is still only in the very first parts of the dentin layer, you could still remineralize. Once it's gotten through, there's like a threshold there, that unfortunately we do need to cut into that and fill it. But again, you could be very conservative with how much you cut. Too many dentists are cutting more than necessary.
Yeah.
Destroying more tooth structure, or they're using materials to rebuild the tooth that are still toxic, that still have, BPA in there, or like it's unfortunate, or still have fluoride in there, right? There's still composites, the white fillings that can have fluoride in it. So we want to avoid that. But then even if you had to do the drilling and the filling, we still have to figure out the root cause of the problem, because if they have one cavity, they likely have multiple, or now they're already predisposed to having more of this moving forward.
Because they're continually eating the same thing. Their oral hygiene is the same practice. It's all kind of makes sense.
And
So
even more so now, we've learned more and more the extent to which breathing and proper breathing is associated with cavities and gum disease. Because too many people, like this is a huge topic now as well. We have too many people breathing through their mouths. They're not breathing through the nose. So if you're constantly breathing through your mouth, and this is unfortunately extremely, extremely common in the child population now, if they are breathing through their mouths, they're constantly drying up their mouth. They're also not filtering out the air that's going in their mouth. And again, more prone to all of this bacterial infestation in the mouth.
that's crazy.
There's,
Wow.
there's just so many things.
Little things that we think, oh my God, so my kid sleeps with their mouth open, but it actually is another box that opens up. Wow, that's insane. Do you guys hear the conversation? It's insane how we are kind of like sewing through a lot of different topics and how they're related. I mean, we're talking about teeth. We started out with teeth. The whole thing is about teeth, but now we got into the whole system. It's a whole domino effect. I want to read a couple of more questions. Lily is asking, so what about wisdom teeth removal when it's medically necessary?
So, oh, huge, 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 huge.
Lily, listen up.
So I know medically, like, what does that mean, medically necessary? If you're saying that it's infected already and there's no other option, okay, I understand. You know that ancestrally, like let's say we go back 50 to 100 years or so, wisdom teeth didn't need to be removed. That wasn't a thing. People think that just because it's common now, it's normal. This is not natural. Our jaws are supposed to be able to hold in our wisdom teeth. They were there for a reason. So the problem is the constriction. The issue is that why are our jaws smaller now that they can't have the wisdom teeth there? So my advice is if this is for a child and they're being told, potentially to take out wisdom teeth, see if the child can still go through expansion. We want to make room. And you'll often find that the moment you start making room, the teeth can come in. If this is for an adult, the teeth are impacted, but they're not actually causing any problems, why are we taking them out? Like wisdom teeth should not be prophylactically taken out. I
But
hate
it's
the fact that
medically
I have
necessary.
but what does that mean?
I don't
Medically
know.
necessary, why?
Maybe it got infected. I don't know. I don't know. She said medically necessary.
She is welcome to ask me questions if
So
she wants.
Lilia, connect with by the way, Diana is so approachable, you guys. Like she'll answer your questions with so much love and patience, which I so appreciate you for that also. She just like she'll sit down and she'll answer questions. So don't feel like you have to, like feel intimidated or anything. Please just connect with her. I want to ask another question. This one is a big one. What would you recommend for a child who has a dead milk central incisor? I don't know what that means. I was told to remove it, but I didn't. Will this impact his adult teeth or nerve? Is remineralization even possible? So as long, hold on a second. Even a possibility to long after the impact? I'm not sure if I understand this question. Is remineralization even a possibility so long after the impact? Does this
So the
question make
question
sense, or you want me to read it
is,
again?
I think she's talking about a baby front tooth. The
Dead
question,
milk central incisor.
yeah, milk primary. Their probably upper front tooth. So if the question is, it was like trauma and the tooth is still there, as long as there's no present abscess on it, right? So if there's a pus pocket there and it's like you see it, then yes, please take it out because it's affecting the bone there and it can potentially affect the permanent tooth. I had to do that for my son. I remember he was 3 years old and this was my eldest. And I was right after dental school, I think. He had fallen at one point, a year earlier, an entire year earlier. Nobody would have thought anything. This kid did not have any cavities, nothing. And one day, my husband is brushing his teeth. He pulls up his lip. He's like, Dana, what is this? I look at it, I see that abscess. I started crying because I already knew what it meant. I knew we had to take the tooth out. Like, I'm not going to keep it in there. We had to take it out. If it's abscessed, please take it out.
So she
If it,
says there's no abscess and it's impacted in the jawline.
okay, if they can send me an x-ray, I'm willing to take a look at it. Have her reach out to me. It has to.
Yeah.
What it is.
Kid ran into a table and the tooth died due to trauma. That's what happened. Oh my God, Lily, that's
How old is he?
died on impact. I believe her son is 7, 6.
So if this is his baby tooth, it should be on its way out already. If it's not moving at all, and this is his baby tooth, at this point, take it out.
He's 6 years old, she says, yeah.
Yeah.
If it's a baby tooth, just take it out, right?
The
But
adult
but
tooth
she
is
should just
there.
consult with you just to be sure. She said she'll reach out to you. Okay, great questions. My gosh, I'm impressed. Another question is from Elisa. My son's wisdom tooth is growing sideways and it's causing swelling. The oral surgeon recommended pulling out both wisdom teeth on that side. What should we do? Oh my God, poor babies.
Oh my God, yeah. If it's growing sideways, it depends on how bad sideways. If it's completely like this and there's no way to upright it, they're gonna have to pull it. There's not gonna be another option. Because the again, guys, so the issue here is when I say prophylactically, it means there's too many dentists and oral surgeons are taking out wisdom teeth before any problems at all arise, right? They're saying, oh, you have your wisdom tooth there, and they're not popping out, nothing is happening, right? No one is complaining of any issue, and they're being told to take it out. In those cases, I'm suggesting not to. If you are already experiencing problems with the teeth, and you're older and there's no, they're not going to be doing any orthodontics, you're not expanding anything, you're not going to be making any room for anything. If you're symptomatic, you need to treat it. So I want to make sure like this is clear. I don't tell people to not take care of problems. You have to take care of an issue when it arises. I'm all about being proactive about what can be done in order to avoid the problems. And there's so many ways to avoid the problems. I'm not a pediatric dentist, but I love to see children because at the end of the day, that's the future. And whatever we can do to help them now so that they're not running into these problems afterwards, that's where we really want to do. In terms of adults, there's plenty we can do to avoid more aggressive treatment. You know, jumping to root canals and pulling out the teeth and doing all of that, if you can hold on to your teeth for as long as possible, because you need it for functional purposes, for longevity, you need to have, healthy mouth, healthy oral cavity. Yes, I can help you there. It's really all about having conservative, comprehensive approach.
Incredible. Wow. It's that's amazing. That's more than what you can Google, by the way, you guys. And I think we're gonna end with this question. And then whatever questions that you guys have afterwards, maybe Diana will go in the chat and answer, or you could just reach out to her. But after this question, I'm gonna turn to Diana's practice because I want her to talk about the alternatives in dentistry that she believes will prevent or can prevent a lot of the root canals and cavities, and we can remineralize, right? So the question is, what's your take on gum recession? How to reverse and or prevent?
Okay. Again, it's multifactorial, right? There are so many things involved in gum recession. Um, one of the biggest components is inflammation. So if you're going through an inflammatory process, whether it's in the mouth or in the body, it'll oftentimes show it up in the mouth as well. So inflammation can lead to gum recession. If your bone is inflamed, you have all of these enzymes going in there, breaking down the bone, the gum will follow the bone. That's one aspect of gum recession. Another part of it would be, again, like a physical structure there. So how are your teeth coming together? If your teeth are not coming together in an ideal position, you're putting forces on the teeth that are hurting the gums. So it's physical. So your gums are physically being pulled away from the teeth. It can also come from tissues like frenulum. People have been hearing about lip ties and buccal ties. They're literally tied to your gums. So if your mouth is restricted in that area, that can also be pulling away and leading to gum recession. So it's here again, what is the root cause, right? What is causing the recession? We need to figure that out first and then see how we can help.
Okay, so let's stop there with questions because I think we've answered really great. You guys are amazing. I love you guys. This was wonderful. So any other questions, you can continue putting them in the chat and Diana will hopefully find the time to answer, or you can directly, and I will put all this information after the live, also how to contact her. Also, she's the gentle dentist on Instagram, and I think that it makes sense. And she has another account as well, so we'll post that. But right now, I want you to touch upon some of the things that makes you different from other dentists, from traditional dentists, I guess you could say, or modern day dentists. And also, please touch upon, I believe you were talking about ozone or maybe yeah. So can you please just tell the audience what is the difference, right? What they can expect when they meet you, and what are some of the services that you believe are a must for prevention?
Sure. Thank you for giving me the floor there. So I am the proud owner of Mineola Dental Wellness, located in Mineola. And we've only been in business for actually almost 3 years now, which is great. I finally did my own thing. And we have a comprehensive approach. So when I see my patients, I am looking for a thorough medical history, dental history. I am giving them a very thorough exam. Many of our patients are going to go through a cone beam scan. It's a 3D X-ray because, again, I want to look at what issues are underlying there. I am trying to get to the root cause of what's going on. So, like I said before, it's not about drill and fill, dentistry. I want to see why are we having problems, whether it's gum disease or cavities or malocclusion is a huge one. A lot of times, patients will come to me because of sleep disorders. I focus on that as well because, again, it's all interconnected, airway problems. And I come up with a treatment plan that focuses on, yes, taking care of the dental issues that they might be a little bit more familiar with, but also figuring out how we can help their overall health. I like to, because of my educational background, I like to think of myself as kind of the centerpiece, to know a little bit about everything and then properly refer them out when necessary to specific kinds of practitioners that are outside of the dental environment. And one of the biggest, I feel like, issues within the medical community and often dental community is that there isn't that centerfold where if you are going to a specialist, because there's not enough communication, there isn't that one doctor that knows what's going on everywhere and can actually help you because they're, the eyes and ears everywhere else. So I like to be that centerfold and work with practitioners that can get back to me about what's going on with our patients. So we could have that thorough approach to them. So yes, so ozone is a huge part of my practice. Ozone is a natural gas. It's an O3 gas. It creates an environment in which microbes can survive. So it's a natural antibacterial, antifungal, antiviral agent. It was actually within the holistic community used a lot during COVID to fight the virus successfully without having to do other things. So it's huge. And in outside of the US, it's actually used very commonly within medical practice. So ozone is a huge part of my practice. I use it every single day on a regular basis. We have ozonated water running through our chairs. So every cleaning, any dental procedure, it's already like helping sterilize the environment. I use it to help remineralize teeth and to help fight gum disease. It's very, very big in the practice. I have a remineralizing protocol that I go through my patients. So yeah, I talk to them about supplements. It's a very different
The
kind
whole
of.
full-on approach. So this is incredible. And also, it's a very, very calm practice. Like when you walk in, and we're going to share with you her Instagram and her phone number and her location. But when you walk in, there isn't one person that isn't smiling. There isn't one person that isn't happy to see you. It is such a beautiful environment. You really do feel like you're not in a hospital setting, which unfortunately, is what it looks like whenever you walk into the regular dentist. And remember, we can't, I think today we can't live with just one way of life, just either holistic or the medical. There needs to be a balance, right? There needs to be a balance because we are real human beings. We need nature. We sync with nature. And if we can prevent, yes, there might be an investment, right? There might be, but we invest into shoes, into bags, into houses, into cars, into movies, travel. We invest into all of these things, but then we pay the medical bills when, something goes out of our body. We're thinking if somebody doesn't take insurance or whatever, let's say, that's why we kind of don't go to the holistic. And I was fortunate enough that my parents actually found a holistic naturopath when I was 14 years old. I used to have a severe anaphylactic shock for years. I had started with peaches and it went into anything red. And my parents found this naturopath and she detoxed me. Apparently, it was from the whatever childhood vaccines, and it's just a whole bomb in there. And then once she started, detoxifying me, I never had an episode ever, ever, ever. And I can eat strawberries, which are my favorite, and I couldn't eat them because I would literally like swell up and die. It was horrible. So when I went through that experience personally with the holistic naturopathic doctors, my whole world turned around. And I am used to going and paying out of pocket to these professionals because thank God we're really never sick. Like if I get sick, it's for like a few hours or maximum a day, and it knocks it all out. Because when you train your immune system to do the right thing, it will perform on that level. It's like training the best employee. It's like buying a house of your dreams and putting all that money into it so it works for you, right? The plumbing, the electricity. The plumbing and electricity of our body are our internal system, our organs, right? The endocrine system, we have the lymphatic system, as I spoke about. We have an enormous amount of systems, right? The central nervous system. I mean, we are such an incredibly divine being that there's no way that one or the other industry can 100% look into it and say, this is what we need. So, in order to live happy, healthy lives, at least to the best of our abilities, is we do need to invest in us, right? It's just like in business. I always say this. If you don't self-develop, you will die in business because you can hire as many people as you want. But at the end of the day, if failure comes and you can't pick yourself up, it's because you didn't invest in yourself. Same thing with your health. And the mouth, I actually remember very clearly when I was younger, people were telling me, and if anybody's from Germany, please clarify this. But in Germany, there was a rule, maybe still there. When you go to a doctor, they are asking you to bring them a clean bill of health from your dentist. And until you bring it, they don't even speak with you. So when I heard that, I was like, wow, there must be something to the dentistry through your mouth. Because remember, mouth is also an excretory organ, right? Just like our skin, just like the back, right? When the end result of all the eating. So when we're exhaling all of the bacteria that leaves the body, it goes through your mouth as well. People don't think of it that way, right? Like just like the skin, and you need to protect it and take care of it and not apply all the junk, right? You need to understand that it all related. If you're already buying organic food and you're not taking care of your body, going to the right specialists, you're buying organic food is like you're wasting your money. You are. And I buy organic food. So I'm talking from all of this is coming from personal experience. Nothing I put out here into the, social media is something I didn't go through myself. So take care of yourself. I'm so grateful to you, Diana, that and it's so difficult for professionals to speak on the subjects of holistic and health because there's so much scrutiny and the cancel culture and how dare you say it and what if somebody, and so we're all adults, right? I'm literally doing a live for adults and hopefully for type of adults that can take everything with a certain amount of grain of salt and do their research, right? We're not making any claims. Diana didn't come here and say if you don't cancel your appointment, you're gonna die. No, it's not the truth at all. She's just giving us an alternative.
By the way, guys, please go see your dentist. And if you feel like they're not doing a thorough enough, job, then go see another one. I am in no way saying to cancel your dental appointment. Please go see them. And oftentimes, this whole thing with insurances to go every 6 months, made up by insurances. No dentist decided that you should be going every 6 months. You should probably be going more often. I hate, I'm not an insurance practice because frankly, insurances do not care if you save your teeth. It is cheaper for them to have all your teeth taken out and give you dentures. It is cheaper. So please don't base it on that. Your mouth is of utmost health. It's so important.
Yeah.
Just find the right person for you.
Correct. And so if you'd like to connect with our gentle dentist, Diana, would you please let us know where we can find you and what is the best way to contact you?
Sure. So the office, as I said, is Mineola Dental Wellness. You can follow us on Facebook and Instagram at Mineola Dental Wellness. I'm also the Gentle Dentist on Instagram. Our phone number is 516-441-2214. We're located right on Jericho Turnpike in Mineola.
So if you want to get out outside of your comfort zone and really just at least have a consultation with her, at least give her a call and talk to her. Tell her, Diana, I don't know what the heck I'm doing with my life, but I want to start somewhere. Like,
Excellent.
what? Because it's true. Some people are like on the fence. A lot of times after I did a cancel your mammogram live, do you know how many people messaged me? I got calls from everywhere. I don't even know how they found my phone number. They said we Googled it on I don't know. I was shocked at the impact that Cancel Your Mammogram Live did. If you guys have not watched Cancel Your Mammogram, you must watch it.
I enjoyed
Must
it. I
watch
cannot
it.
wait for her to open up in New York. I
She's
still have not
opening up
gone
this
for an
year.
mammogram. I'm like, I need this.
Yeah, and how toxic mammograms are and how they cause cancer. And she's a breast surgeon. So when I want to bring more of this type of caliber people where they're literally going against the modern culture and speaking out, which is not easy. And I'm just dragging them into this because I like to disrupt in a positive way. I think we need it. And I don't want to sugarcoat anything. There's no need to sugarcoat anything. We're adults. We can Google things. We can ask we have friends who are in a medical field and a holistic field. So please do your due diligence. Google is free. Or whatever search engine you're using, it's free. YouTube is free. Go and research these things. What's remineralization? What's ozone therapy? And if you guys like me, sometimes I listen to an incredible lecture and I'm thinking, well, I don't even know what to ask this person. Great. That's exactly what you should ask. You call Diana and you say, I don't even know what to ask you, but I heard the live and I'm curious. What's this thing, holistic dentistry? And she'll tell you. And it's super simple. And let's give them a nice consultation. As always, she's very, very warm person, as you can see. And thank you so much, Diana. Thank you all so much for joining. I'm going to announce the next live as soon as I find somebody like, oh my gosh, let's cancel that appointment. So stay tuned. And of course, follow us on all social media platforms. We will post all the information. And Diana, any final words before we close?
Please, everyone, just take care of yourselves. There's so much information out there. I am open to any questions you may have. So I'm here for you. Thank you, Yelena.
Thank you. Thank you. Have a good day.